Good morning to all. Myself Jincy, lecturer from Emmanuel Arasar College of Pharmacy. Today we are discussing about the topic pharmaceutical dosage forms. Introduction to pharmaceutical dosage form. Dosage forms are the safe, effective, and stable terms in which medication will be delivered into the body. Dosage forms are essentially pharmaceutical products which are marketed for use typically involving a mixture of active drug components and excipients. These dosage forms are classified in a number of ways as mentioned below, by which drug molecules are delivered to the site of action. Form wise: solid dosage form, liquid dosage form, semi solid dosage form, and route wise: oral dosage form, topical dosage form, and parenteral dosage form. Then third one, release date: sustained release, then release rate, sustained release, prolonged release, controlled release, and targeted drug delivery. Solid dosage forms are classified into unit dosage form and bulk dosage form. Bulk dosage form for internal and external use. For internal use are classified into two types, namely fine powders and granules. Then granules may be classified as two types, effervescent and non-effervescent. For external use, non-effervescents are classified as, for external use, ear powder, snuff powder, ophthalmic powder, dusting powder, and tooth powder. In unit dosage forms are classified as tablets, pills, catchets, capsules, powders, and suppositories. Then catchets are classified as two types, namely dry seal and wet seal. Does internal use: oral, topical, instilled in body cavities, and topical. Then internal use may be classified as two types, namely aqueous and hydroalcoholic. Aqueous may be classified as drops, mixtures, solution, syrups, and linctuses. Then hydroalcoholic may be classified as elixirs. Then oral topical, mouthwash, gargles, throat paint, etc. Then instilled in body cavities, ear drops, nasal drops, sprays, dutches, and enemas. Then topical may be classified as four types, namely solutions, lotion, paints, and liniments. Then biphasic dosage form may be classified as two types, namely emulsion and suspension. Emulsion and suspension. Oral, external, ophthalmic, and parental. Both are same. Then semi-solid dosage form may be classified as two types, namely internal and external use. External use is classified as ointments, paste, and suppositories. Ointments, oleaginous base and absorption base, emulsion, and water washable base. Then internal use may be classified as two categories, namely gels and jellies. Then aromatic water, semi-solid dosage form classification. Aromatic water, they are saturated aqueous solution of volatile oils or other aromatic or volatile substances. For example, camphor water, concentrated peppermint water. Mainly used as flavoring agent. They are prepared by distillation. For example, strong rose water, orange flower water. Then solution method, example dill water and pepper water and camphor water. Then alternate solution method, for example, volatile oil is thoroughly mixed with an inert adsorptive agent, example talc. Then 1 liter of purified water is added and agitated for 10 minutes. The solution is filtered until a clear filtrate is obtained. For example, concentrated peppermint water. Then catchets. They are solid dosage forms meant for oral administration of nauseous and disagreeable drug substance. These are molded from paper, a material made by pouring a mixture of rice flour and water between two hot polished revolving cylinders upon which water evaporates and a sheet of wafer is formed. In the filling of gadget, the medicament is placed between two pieces of a gadget, which are then either wet sealed or dry sealed. Gadgets are made in a variety of size, holding from zero point 0.2 to 2 grams of powder of medium density. Before administration, they are softened by immersion in water for a few seconds and then taken with a draught of water. Then tinctures. Tinctures are sweet viscous liquid oral preparation containing medical substances which have demulcent, sedative or expectorant preparation. The simple solution or administrations containing a high proportion of syrup and glycerin have demulcent effect on the mucous membrane of the throat. For example, codeine tincture. They are alcoholic or hydroalcoholic solution of chemicals or soluble constituents of crude drugs. For example, orange tinctures, ipecacuanha tincture, cardamom tincture. Tinctures contain 20 to 90% alcohol and spirit containing volatile substances only. Then spirits. Spirits are alcoholic or hydroalcoholic solution of volatile oils which are used internally for their medicinal values and flavoring agent. Spirit may be also applied externally or used by inhalation. Example, spirits may also applied externally or used by inhalation. For example, aromatic spirit of ammonia. They are prepared by simple dissolution, maceration, chemical reaction, and distillation. Then proof spirits. They are defined as mixture of alcohol and water which is 51 degree Fahrenheit weight of 12 by 13th of an equal volume of water. The strength of alcoholic preparation are medicated by degrees over proof spirit or under proof. Any alcoholic solution which contains 57.1 percentage weight by volume by weight alcohol is a proof spirit and said to be 100 proof. Elixirs. Elixirs are clean liquid or alcoholic and oral preparation contain potent and nauseous drugs which are plenty flavored and usually attractive colored. They are more stable than mixed. Classification. Non-medicated elixir. For example, compound benzaldehyde elixir and medicated elixir. Chlorpheniramine and chloral hydrate elixirs are the examples. Then syrups. Syrups are concentration aqueous preparation of sugar or sugar substances with or without flavoring agent and medical substances. Medicated syrup and flavored syrups are the classification. Syrup Indian pharmacopoeia is 66.7% weight by volume, weight by weight solution of sucrose, where a syrup USP is 85% weight by volume or 67.7474 weight by weight solution of sucrose in purified water. Then draught. Draughts are oral liquid preparation meant to take as a single dose. A single dose of mixture is usually known as draught. Male fern drought and paraldehyde drought. Oxidizes to acetic acid on storage leads to death. Then drops. Drops are liquid oral preparation of potent drugs or vitamin which are given into original form without dilution. Then eardrops. They are liquid preparations meant for instillation into ear. In these preparations, the drug is usually dissolved or suspended in a suitable solvent such as propylene glycol, polyethylene glycol, glycerol, alcohol, and water, or a mixture of these. Aqueous vehicle is generally not preferred because the secretions in the ear are fatty in nature and as such these do not mix with water. Then eardrops. They are Aqueous and oily solutions or suspensions of one or more active ingredients for instillation into the eye sac. These are sterile, free from foreign particles and irritating effect. They are categorized into numbers of various types. Liquid preparation for application to the surface of eye, then semi-solid dosage forms, for examples ointments, creams and gels, then parenteral products for subconjunctival or intraocular injection, then solid dosage form intended to be placed in contact with surface of eye, for example Ocusat, then ointments. Ointments are semi-solid preparations intended to adhere to the skin or certain mucous membrane. They are usually solutions are dispersed of one or more medicaments in non-aqueous bases. Ointment bases are often anhydrous and include fats, oils, and waxes of animal, vegetable, or mineral origin. Then eye ointment. They are sterile semi-solid preparations of homogeneous appearance intended for application to the conjunctiva or margins of eyelids. They contain one or more active ingredients dissolved and dispersed in a suitable base like soft paraffin, liquid paraffin, and wool fat. They contain suitable amount of antioxidant, stabilizers, and antimicrobial preservatives. Then gargles. Gargles are aqueous solutions used to prevent or treat infection. They are usually available in concentrated form with direction for dilution with warm water before use. They are brought into intimate contact with the mucous membrane of throat and are allowed to remain in contact with it for few seconds before they are thrown out of the mouth. Then creams. Creams are viscous semi-solids are usually oil and water type emulsions or water in oil emulsion types. Creams are usually pseudoplastic and exhibit low yield values. The microstructure of oil and water type cream may comprise several phases such as viscoelastic gel with fixed water, dispersed oil, free water and crystalline material from fatty alcohol. Then gels. Gels are transparent or translucent semi-solid or semi-solid preparations consisting of solution of one or more active ingredients in suitable hydrophilic or hydrophobic bases. Then pastes. Pastes, these are same as semi-solid preparations for topical application that differ from similar product in containing higher proportions of finely divided medicaments than poultices. It consists of moistened masses of vegetable materials or clay that are sometimes heated before application. For example, sulfoxides, amides, surfactants, pyrrolidones, calcium thioglycerate, propylene glycol, etc. Then tablets, solid unit dosage form intended to be administered into the oral cavity. Then capsules. Capsules are solid dosage form usually containing one dose of drug enclosed within a small water soluble shell of a suitable form of gelatin. Then pastilles. Pastilles are solid medicated preparations intended to dissolve slowly in the mouth similar to touches and lozenges. Then pessaries. Pessaries are solid dosage forms meant for introduction into the vagina where they melt or dissolve and exert to a local action. Then pills. Pills are small round solid dosage form containing one or more active ingredients mean for an oral administration. Then paints. Paints are solutions or dispersions of one or more active ingredients intended for application to the skin or mucosa of mouth and throat, usually with the help of a soft brush or a cotton swab. Then linked uses. They are viscous, sweet, liquid oral preparations that are usually prescribed for the relief of cold. Then liniments. They are liquid or semi-solid preparations meant for application to the unbroken skin by friction or applied on lint or other suitable material and placed on the affected part. They may be alcoholic or oily soap or soap solutions or emulsions. Then lotions. Lotions are liquid or semi-solid, semi-liquid preparations meant for application to unbroken skin without friction. They are either dabbed on the skin or applied to the suitable dressing and covering with waterproof material to reduce evaporation. Then lozenges. Lozenges are solid dosage forms containing medicaments in a sweetened and flavored base intended to dissolve slowly in the mouth. Then mouthwashes. Mouthwashes are aqueous solutions containing one or more active ingredients for use in contact with mucous membrane of the oral cavity, usually after dilution with warm water. Then nasal drops. They are solutions, suspensions, or emulsions containing active ingredients intended for instillation into the nostrils, usually with the help of dropper. Then nasal sprays. They are suspensions or solutions of drugs intended for spraying into the nostrils. Thank you.